a weekly program about events in the two Virginias.
Good Sunday morning, everyone, and welcome to this week's In Focus. I'm Erica Greenway. Today we're going to be talking about a type of treatment that many of you may not be too familiar with. It's called Platelet Rich Plasma, and it's used to treat things like tendons and ligaments, actually without surgery. Now, it's relatively new in our area, but we do have a doctor with us who does use this on some of his patients, and that's Dr. Horwitz, who is a podiatrist over in Bluefield, Virginia. So thanks so much for joining us this morning.
Thank you for having me.
Now, I know we have a piece of equipment that you guys actually used for your treatments, and we're going to be talking about that in a minute. But first, if you could, can you give us an overview of what PRP is? Because I know a lot of us aren't really too familiar with it.
Yes. As you know, when you're young and you run and you have sports, etc., you may trip, fall, and twist an ankle. Your ankle will swell, blood gets in it, you turn black and blue, and in a couple of days you're better. Well, as we get older, that's not the case. So let's talk a little bit about what happens. Our medical scientists have been able to isolate 6 different factors in our blood, or elements in our blood, that help us heal. Heals tendons, heals ligaments, heals fractured bones. And we have been able now to isolate these 6 different factors that we take from your own blood and then introduce them into the injured part to help the tissue heal. And it's totally revolutionary. It's on the same scale as they are now doing with the different medical things with stem cells, etc., that it's just a new medical advance. And the truth of the matter is there are maybe about 200 or 300 of us in the United States and really in the world that have been qualified to do this type of treatment.
Yeah,
so it's not only new to this area, it's new to the world.
Yeah, but it's been in the news quite a bit lately, too, and I know a lot of people are talking about it because it is so amazing. We actually have a story now from NBC's Diana Gonzalez, which kind of explains more about what PRP does and how it can help people.
Tennis pro Tom Mendenhall is getting treatment for his painful elbow.
I tried some therapy, whirlpool treatments, ultrasound treatments, and it didn't work.
Then Tom found out about PRP, which stands for Platelet Rich Plasma. First, a patient's blood is drawn and then goes into a centrifuge. The high-speed spinning process helps separate blood components. Plasma with concentrated platelets is then injected into the patient at the injured site. Orthopedic surgeon Dr. Alan Lazar explains how platelets work.
They can help grow ligaments and tendons and help heal joints. And up until now, we thought platelets, really all they did was stop bleeding. But what they really are, they're the initiator of healing in the body.
Tom is one of 50 patients treated by Dr. Lazar. He says it can take a while to feel the results.
The first 10 days are a little more painful, the platelets are a little irritating, and then with a month or 6 weeks you see a major effect.
Considered an alternative therapy, Medicare and most insurance companies will not cover the costs of PRP, which runs $500 per injection, and sometimes 3 to 6 are needed. Responses to treatment vary. For Tom Mendenhall, it is worth a try.
I'm not going to do surgery. There's just no way, because surgery is not guaranteed either.
The American Academy of Orthopedic Surgeons says, quote, available data suggests that PRP may be valuable in enhancing soft tissue repair and in wound healing. However, the clinical role of PRP in bone repair remains controversial. Diana Gonzalez for NBC News.
So that was a good summary of kind of what PRP can do for people. We saw one of the patients who actually benefited from it. But can you kind of tell us more about who is eligible for this and who can benefit from it? You said people who are older sometimes need something like this, but can even younger people benefit?
Oh, yes. As you saw, I don't know if it was on that particular one, where they've used it in the pro football leagues. Mm-hmm. They use it on athletes, young athletes, people your age, actually. We're living in a world right now where most of us wear shoes, we drive cars, walk on concrete, and we don't get the same exercise or the same nutrition. Most of us are in buildings with fluorescent lights, we eat processed foods, etc. So we're a different creature today than what we were in the time of our grandparents. And some things are better, some things are not as good. So our healing process, we have dampened that. And we all, take 2 aspirins, call me in the morning story. And we all become, if it hurts, take a pill, don't live through it. Well, Mother Nature's been around for a long, long time, and she has formulated her way of healing. And we moderns, we think we can get around her. And what we generally do is we kind of mess up the system a little bit. So what we find is that most people can benefit from it. They've done it as young as people as 8 and 9 who have long tendon tears and fractured bones that don't heal. They use it a lot in Israel with fractured bones and with wound injuries from shrapnel. So it's really a well-known subject. It's been well researched. And the nice part about it is, like in the Hippocratic Oath, the medical oath, the first part of the oath is, do no harm. Well, you and I both know that no matter what you buy in the store, one, you don't know what you're buying, with all due respect to everybody, especially in generics, you don't know what you're getting. And you don't know how it's going to act with the other medicines you're taking or all the other stuff you're taking, and how many people die from just taking aspirin. So this is a very safe, nice, clean method of aiding and healing.
Right, and safe too because you're actually using your own blood for the treatment, right?
Absolutely. You could never use somebody else's blood, so we're not worried about infection. There's never been an infection reported with this. It is FDA approved. There are multiple companies. I like Harvest, but there are other companies in the field. And as time goes on, I'm sure it'll become less expensive.
If you would, walk us through exactly what the procedure involves and how this is used.
Absolutely. We see a patient, and they may be a diabetic with an ulcer that isn't healing. They may be an athlete, young, who sprained an ankle, and it's important to get back on the field. Tennis players a lot, although we don't have any Agathes that I know of in this area, but we might. Football players with sprained ankles, dancers, especially girl dancers, because they're always on a diet, never eating enough food. They have to be thin. And so their bones are more fragile, and so they're more tend to fracture bones or tear ligaments. Now, you and I have both heard them say, well, it's better to fracture something than tear a ligament. Well, that happens to be true. Ligaments are really poor healers. They have poor blood supply, poor nerve supply, and they're relatively fragile. So when they tear, in general, they don't heal well. And then what does people do? They'll either take an aspirin or 2, or Motrin or Indocin, and we know from research that that reduces what we call the healing factors that our body normally produces, and that is a hormone called prostaglandin P2G, which is suppressed with non-steroidals, aspirin, Motrin, Indocin, Celebrex, on and on and on. So when that happens, then people don't heal, and then that leads to chronicity, or the problem becoming worse. They end up tearing tendons fray, and it goes from one problem to another. So this is just another medical intervention that is relatively easy, relatively cheap, absolutely safe, and when it works, and they've had excellent results, I've had excellent results with it, then everybody benefits.
All right, great. And we have a lot more to talk about. I know you're going to talk about some of your patients who've actually benefited from it right after this break, so stay with us.